And the idea is so that we have this as a resource that we can share with people who are able to make this inaugural occasion. So welcome everybody to the first of the reincarnated International Society of Urban Health African Action Group / chapter. It's a real pleasure to have a wide variety of people on the call here. We've got a couple of hours, and the idea for this event, webinar, workshop is really to we're going to keep it as flexible as possible, and importantly, we're going to keep this as interactive as possible because we really want to hear from you. The overarching goal is to build an urban health community of practice across the African continent. So that's east, west, north, south, central. And so we really want to hear from you, okay? I think that is going to be the premise of the entire event. You will see that your contributions will be really critical to shaping what this is, what the community is, and what you would like to see. So what we've set out for the next couple of hours is we'll briefly introduce the members of the steering group who have worked to put this together, and I will give a little bit of an intro of the context of our thinking so far, bearing in mind that this is really just our thinking and our thoughts so far, and part of the point today in the breakout groups would be to hear from you. Does this sound like something you'd be interested in? Does it sound like something that would contribute to your work? What else would you like to see, etc.? So I'd share those brief thoughts. And then we have two lots of speakers very quickly. The first would be Carlos Dora, who is the president of the International Society for Urban Health, who is going to share some findings from scoping exercise that was conducted and commissioned by the WHO on urban health research. It was done globally, so he's going to share with us some of the findings for what they found in Africa, just to kind of set the scene a little bit from that, because that's been luckily for us, that's been an exhaustive body of work that's been done recently in the last few months. And really just park that in your mind, I think, and ask Carlos to kind of put some questions to you to kind of inform our breakouts. So these are the kind of things that are coming up from the mapping. What do you think? This is kind of thoughts that we're thinking, and that will seed some of the discussions in the breakout groups. And then, as a showcase of the kinds of research or urban health research that is already going on the continent, and the kinds of research that we want to unearth and connect, we will have two collaborators in conversation from the University of Cape Town and from formerly the Western Cape Government's Department of Human Settlements in South Africa, speaking about research collaboration they undertook together on health and human settlements and some of their experiences, just to kind of set the mood for, okay, Carlos says this is what we need to do, and this is a landscape of experiences, and then bringing you right down to experiences of a researcher, policy actor collaboration. We will then go out into breakout groups, and that will be an opportunity for you to connect and meet other people. In this, we have 27 people, 28 now. So I will give some instructions around the breakout groups just before the time, but it really would be around connecting and meeting perhaps people that you haven't met before, and there will be some guiding questions to think through, and then we'll come back in plenary and you share some of those thoughts and on the discussions that have been had, and we'll together shape a way forwards. Does that sound reasonable? Come on, in the spirit of interaction.
Yes.
Does that sound reasonable? Yes, great. Okay.
Yes.
And then I realized
amazing. Sounds amazing.
Fantastic. Yes, that's it. You know, this is the Africa Work Group. We have to have some kind of call response kind of situation here. We can't be have like one out. Okay, and I've been speaking for 5 minutes and not introduced myself. Hello, everyone. I am Tolu Oni. I am a public health physician and urban epidemiologist. I am a Nigerian-born, UK-bred, South African matured. Citizen of the African continent. I an urban epidemiologist, so I work at the University of Cambridge, but I have affiliations in Cape Town and Pretoria in South Africa, and I work at that interface of urban health and urban health, climate, and food and activity built environments. So that's a little bit about me. I'm going to ask very briefly each of the members of the steering group to introduce themselves, so you have a sense of who's behind this. So I chair this group with Charles. Charles, as co-chair, would you like to introduce yourself briefly?
Hello, everyone. I'm Charles Abikemi. I'm currently based at LSE and working on an African Health Observatory platform, which is a platform to promote evidence-informed policymaking in the African region. Perhaps since Tolu started it, I am British-Nigerian, but also Afro-European now, I would say, with a French.
Oh, we're on for making up new words. Fantastic.
Exactly.
Amolo, would you like to go next?
Sure, Tolu, thank you. My name is Amolo Ambole. I'm based in Nairobi, Kenya. I am a program director at Big Win Philanthropy. This is a foundation that supports African governments directly with the aim of helping them to achieve transformative goals for their citizens. Currently, I'm working on a new city support program, and I'm here to, learn from all of you since you're working in the urban space. And I hope that from our program, we're also going to contribute to this conversation. Previously, I was a researcher at the University of Nairobi. I also spent quite a bit of time in Stellenbosch, so I will say that I am Kenyan South African. Thank you.
Yeah. Thank you, Amolo. Amy?
Hi, everyone. I'm Amy Wyman. I'm from the University of Cape Town. I'm based in Cape Town. I'm a junior research fellow at the African Centre for Cities at UCT, as well as a PhD candidate at the School of Public Health, but just wrapping up there. And yeah, you'll be hearing a lot more from me just now, so I will keep this short and sweet, but I'm Cape Townian through and through.
Keeping it simple. Thanks, Amy. And lastly, Milan.
Hi, everybody. I'm really happy to be here. My name is Milan Tandu. So I'm trained as an epidemiologist and medical anthropologist. I'm really excited about health impact assessments in low and middle income countries, and been working in Africa now for the past 10 years. Yeah, I'm happy to be here and looking forward to the exchanges. Thank you.
You didn't make up a new term for yourself.
Where I am. Yeah.
Okay, great. So that's the steering committee, and supported really invaluably by Gina from the ISUH Secretariat. So Gina, do you want to just introduce yourself?
Sure. Hi, everybody. I'm Gina Gonzalez. I'm a program administrator at New York University School of Global Public Health, but I'm also a program assistant for ISUH, so I've been help supporting this Africa Working Group. It's nice to meet you all.
Thank you, Gina. We appreciate you. Okay, so what I would like to do is just in the run up to introducing Carlos, just share with you a couple of slides on some of the thinking that we've had so far around what the potential for what this community of practice could be. And this has been really just largely Charles and I iterating this, and with input from the steering committee. Some of you who were at the ICUH, the International Conference for Urban Health meeting in a few months ago this year, might have seen this, but it was a small group, so I will share it. I will share it again. So this was, and I know some of you in the room were at this. We held this workshop, Healthy Cities workshop, 2 years ago now, in South Africa. See if you can find yourself. It brought together researchers, people working in government at the city level, the provincial level, in different sectors, from health to urban planning to economic development, to climate and climate action, etc., across 8 or so different cities on the continent. I will share this slide with you so you can have the link to the report, but these were some of the things, emergent ideas. So part of it was providing training, and we really solicited, look, what do people want, right? So if you're a researcher, what are the kinds of research and collaborations that would help you be better impactful? And if you are not in research, what are the ways in which urban health research can support your work, be that in practice, or we also have the private sector represented, be that in practice or in your policy actions. This is some of the key things that came up, and this has really shaped our thinking so far. So it's around cooperation between cities, better connection between researchers embedded in with decision makers, some training opportunities, etc. So bear that in mind. After the workshop, there were some emergent ideas around supporting urban health partnerships in these ways, sharing of practice, exchange of resources, but also research support and just understanding the research support with respect to data and stories and advocacy with respect, again, to best practice, and really supporting the city-to-city collaboration across the continent. So this was the why of this action group, and to be honest, you are the why, you are the what, and you are the how. So really internalize that. But our thinking was that, okay, building on that, how can we create a space that supports this knowledge exchange, that supports this shared learning, that allows us to unearth and map the expertise across, and by expertise I mean academic, practice, policy, across all the different disciplines, activism. How can we unearth this expertise? How can we know each other a little bit more and connect people so that we are able to better take opportunities to get together, to form research partnerships, and to really tackle some of the big challenges that we face on the continent. So the what, as we started thinking about it, was, okay, if that was the why, then the what would be something that curates, that connects, that inspires people who are already motivated to and share this vision of healthy cities, to really catalyze and amplify their impact in this regard, and to support them partly to training, partly to connection, partly to really in any way that you see fit, that would help support integrating health into policy and practice. Our initial thinking in terms of the how would be that we'd have these virtual events every quarter, for example, and this is the first of such events, and the idea would be thinking about the unearthing the expertise, thinking about the shared learning, that we create the space where we have discussants share something. That might be work that has happened, that might be ideas, that might be plans, as a way to kind of seed ideas and seed conversations that we can then go into breakout rooms and tackle in a bit more detail. The idea is to share this as a we would also, we really, and because we're researchers, pretty much most of us in the steering group have a research background in some way, shape or form. We understand how important it is to know whether or not what we're doing is impactful. So it's all well and good to have the event and have the activities, but is it achieving the impact? Is it helping you do the work that you better needed? Is it helping the continent better promote and improve population health. So we'd really seek to tap into your experience. So are you meeting people? Are you connecting? Are you doing work together? Or is it shaping the way you think, the skills that you have, etc.? So this is our initial thinking of getting these thoughts from you. And in the longer term, we would like to explore creating a space where we can better connect needs and capacity in Nairobi and say, okay, you know what, I need research expertise in XYZ for the city, and I can go to a space and find that, because we recognize that the expertise we may need may not be local, but if we have it across the continent, how do we better connect each other? And similarly, Amy could say, as Amy, I have this capacity, this is a training I have, this is what I'm able to do. I can put that there so that Amolo can find Amy and actually matchmake each other without having to come through any other brokers, if you like. So that's the idea in the long term, that we're better able to grow and build this community of practice. And this is the last slide before I hand over to Carlos, is that we really want to reiterate that what we're seeing as this community of practice is importantly not just academic and not just researcher, because if the purpose of this urban health community of practice is to improve health in our cities, then we cannot do it within academia alone. And we see this as a community of practice that involves government, civil society, private sector, academic, NGO, really across all sectors and disciplines. So if you're here today and thinking, didn't realize that, then for the next one, invite you to invite others across those disciplines, because the more diverse perspectives we bring together here, I think the richer the conversations would be. And then because our median age is 19 on the continent, I really think it's critical that we have a strong focus on early and mid-career people, members of the community, and that is early mid-career researchers, early mid-career policymakers, early mid-career practitioners, because we need to better connect the next generation as well of actors that will play a really critical role in creating healthy, sustainable cities on the continent. So that is the idea. Sorry, this is the slides from before. So that was our thinking, right, over the last few months. But obviously, because it's a community of practice, it's co-owned. So we really want to hear from you, which we will do today. But before we do that, it's a real pleasure to hand over to Carlos, who I mentioned is the president of the International Society of Urban Health, who will share with you some preliminary findings of what we know about what is already happening on the continent, so that we all kind of get on the same page a little bit. Carlos.
Thank you very much, Tolu. A great pleasure to be with you and to see the good energy and the positive energy which is coming out of the Africa Working Group. It's also a pleasure to have started as president this year of a network, and having been, I'm Brazilian as originally, have lived abroad and in many countries and work in many places. But basically, I'm a medic. I come from health systems, and I moved into epidemiology and worked in sector policies for a long while, including with WHO and World Bank and some academic institutions. So my background is varied, and I think it's telling that I'm, concentrating in civil society and in networks, because I do think that this is where a lot of the substance and the energy for building better or building new things comes from. So I'm very pleased that you're reactivating or things which are perhaps that already we have in the a seed in the ISUH, the collaboratorium, this idea that you go and you find people and whom you need. I think electronics is essential for the good functioning of networks. And what I'm going to present is a review and analysis that we've done, and ISUH has done for WHO on urban health gaps and opportunities in research, is looking at a new research agenda for WHO. But the rationale behind us applying to do this, WHO did open an expression of interest, was to respond as a network and build on the strengths of the network, which is different languages, different cultures, presence in different parts of the world. And so I think that in a nutshell, that was the approach that we had. So it will be very important to look at identify research gaps and opportunities worldwide, but it's important that we reflect what different cultures, what different languages, and what different parts of the world are thinking and perceiving. So the way we've done that was to have different groups in each region, all ISUH members, to lead the work. And I'm stressing that in the African region, we had Blessing Barrow, Agnes Nanyojo, sorry, I misspelled her last name, and Gerard Salem, when we covered both French-speaking and English-speaking. I believe that Gerard and Agnes are on the call, so they may want to come up with some contributions on their side. I'll present in a nutshell what we've done overall, and then open up to them for their impressions. So we started by having some—
Carlos,
yep.
Wait,
Sure.
Did you mean to share your screen?
Yes, I'm sorry. I'm not.
You're not sharing it. Yeah.
Oh, silly. Share content screen. Everything on your screen, blah, blah, blah. Screen broadcast or Strasbourg? You share your screen, okay. That's my screen. I'm sorry, so that was the approach, the fact that we are a network, a global network, and therefore the way they will approach this task was to engage the network in the development of both the methodology, the conceptual part, and the implementation, with the idea that not only WHO is organizing regions, ISUH as well, but we have at the moment, similar ambitions. I mean, WHO as a UN agency working more and further on urban health and developing a new research agenda, and ISUH wanting to continue its work and strengthen its work also in the regions. So those are the participants in Afro, and also in the other regions who are coordinating. They're all ISUH members. And this was the methodology. So we started by conceptually looking at what's urban health and and we decided to work, for example, on urban health research, but also research for action, and to look at the gaps on what knowledge for action is missing. So there was not only the research part, we also interview people who were more on the action seat. So I think somebody has their microphone on.
Yes.
The framing that we decided to go in terms of determinants of health was quite broad and is going up quite a long way in terms of looking at determinants, including to cultural, political, economic processes that happen at the global, the national level, et cetera, coming down to proximal risk factors and to disease outcomes. A wide variety of research methods, including citizen science, not only epidemiology, but social science, action research, et cetera. In the trust, so the emphasis was considering research translation into action and have a strong grounding on local context and what's happening in different places and what different actors perceive. So we ended up with, these are the methods to get to this urban health research, stakeholders, gaps, and opportunities. We did three things. The first two things are described on the left of the slide. We did scoping review of the literature worldwide, and And within that, it was mostly review papers, because this is vast. It's everything which links health and urban policies and drivers of urban health. So we ended up reviewing urban review papers. There were almost 4,000 of them, and then going in depth into 250 or so. This was done by led by a group in New Zealand, the Philippa Hoden chapter that many of you know. Within that, they also did a special sub-analysis of urban health research priority papers. There were 22 papers which were focused specifically on urban health research priority. So there was the scoping review, and was done in English. We then did a number of regional in-depth one-to-one interviews and some surveys, 122, which were done on the different languages, in Russian, in Mandarin, in French, English, and Spanish, and Portuguese. So it's a bit more the UN languages, which were done by the regional coordinators. And we had an exercise which was global stakeholder mapping and ideas mapping, social network analysis, that used text mining and social media, which is an interesting exercise. I'll tell you a bit about it. And in the regions, there was also great literature searches. So the first bit, which is the scoping review, showed a number of interesting things, like most of the research is done in Americas, the yellow, or in Europe, and the other regions are less represented. This was over 20 years. There's an increasing number of reviews looking at urban health worldwide, and as you look between 2000 and 2021, there's an increasing number of studies looking at that. They were published in different kinds of journals, not only health or urban or environment or social, so there's a good spread there. And the results of this scoping analysis, here are some of the results. Looking at more at interdisciplinary research, sharing of findings of that research, more rigorous study designs, including the longitudinal designs, more on standard definitions to facilitate communication across locations, more context-specific research, working more closely and hearing from marginalized and subpopulations, including residents in informal settlements. I'm giving it's very detailed and it's very interesting. So I'll give some highlights only. Of the 18 articles, that looked at urban health research gaps, those are the four main findings. Climate change was felt to be a big gap. The role of spatial planning and infrastructure, again, a big gap. There's more emerging research in that area, but still we feel a need for especially international comparisons on that. Felt a big need on governance approaches to urban development and urban health. How people shape agendas, policies, programs, what mechanisms, the role of politics, informal negotiation, role of bureaucracy, etc. So I think that's an area of research that we need to focus more. And how is it that decisions get made, and how is it that you get actions on urban health promoted? And also in the importance of methods and knowledge translation. So that was the scoping reviews. The stakeholder mapping took it was used web mining, and it is a different take. So you looked at what's on the web. It reviewed 600,000 documents, not only in English. The first scoping reviews were only in English. And it had to do translations of abstracts, especially from Spanish and for Latin America, and Mandarin from China, because they didn't find enough English abstract translations. And it used an interesting way of finding out what's being talked about in this internet space. What are the conversations about? Who are talking about issues of urban health? And in this mapping, and then finding out who's taking action, and then matching the two, or looking how do they combine, how do they get together. So it's a curious set of results. It's beautiful because I'll show you the colors. It comes out in some maps. So this is an extensive set of sources. I won't bore you with 600,000 compiled documents. Texts were processed for 123,000 documents. And the interesting part is in terms of the concepts, what they've done, they included what the researchers are saying in terms of coining the ideas. What are the ideas which are coming out of how the concepts that seem to concern people? When it came to mapping actors, they excluded the academics because the academics write a lot and they're very much in the web space. And they privilege the actors who are in private sector or in government or in other organizations. So what you have at the end, and you match, or they matched, this is the University of Lausanne with a researcher from Ecuador, who's done that for Habitat 3, the same kind of method. And this is the result for Africa. So what you have in yellow are things which are talked about but are not acted upon. I'm doing an oversimplification.
Carlos, would you mind going into slideshow mode so we can zoom in a little bit?
Yes.
Slideshow at the top of your screen. It said slideshow. No. At the in PowerPoint there.
Okay, sorry. In the PowerPoint slideshow. This thing.
Yeah, exactly.
Yeah. Okay. So what I'm saying is that the terms in blue you have the actors. In pinkish, reddish, you have the ideas which are more acted upon. And in yellow, you have ideas which are prevalent, but which are not acted upon very much. So it's a very wide take, and they've done it for the world and for each region. So I think it was interesting to see what I was discussing earlier. These actors are not academic actors. These are people in government or in private sector, for example. But the ideas and the concepts are concepts that are also shared as, that also draw on what the researchers say. So this was piece of work number 2, that did this mapping of ideas, actors, what's acted upon and not. How do I go back? Okay, so these are for other regions, this is for the world. So again, I won't go into detail. The third item was in-depth interviews, which had a regional focus on languages, as I explained. It's semi-structured. We have 100 interviews and another 20-odd questionnaires where people could not interview in person. A few of the interviews were global because people who, although, and some of them were more related to one country or one city. The rationale was to basically look at what research is perceived as being done, what are the perceived gaps, and where are the perceived opportunities. So that's one part. The other part is to map who are the actors in urban development, in urban health, and in equity. So it's both looking at the research and research gaps and opportunities, and also looking at the actors and seeing how they connect. So that's where we started from. But I think what we ended up with is, in addition to the state of research and actors, we had a sense in some parts of the world of the history of urban health development, how things evolved, and good insights into strategic opportunities for how to move ahead. And I'll give you an example. In terms of the history of urban health development, the importance of networking in Latin America. I'll give you 2 examples. In the city of Belo Horizonte, the fact that university, the local governments, they started working on urban health, and over the years, they took more action, one or the other, depending on where the opportunities were or where it was possible. Because sometimes you have changing government, you have changing university rules, and people change. So the fact that there was a network at the local level over the years, this allowed for this action on urban health to evolve and be taken over and relayed by other people. And I thought that was a very useful insight, because we know that these things happen. Local governments, they change as other governments change. Interests of private sector or other stakeholders change. University priorities also move, and people change. So that was very useful. And the other useful thing from Latin America as well is that the fact that there was a network in Latin America working on urban health over the years, and people knew each other. At one moment, there was an opportunity for doing a piece of research, which was comparative research on urban health by the Wellcome Trust. And they created something which is called Salurbal, where different parts of the region took leadership into different parts of the research. So the result is that is a very potent, I think, story of how is it that now they have 400 odd cities where they're doing comparative analysis using comparable methods that was enabled by this research grant. But the research grant was possible because there was a network that existed there, and because there were different people taking leadership in different aspects. And I think that in itself, I think it was very useful. I'm just raising a few things, and I'm having an obvious bias of being Latin American looking at. I did the qualitative interviews for Latin America, so. But in terms of the strategic opportunities, so I'll point out, and maybe I'll leave Agnes, I'll say a few things and leave Agnes to say something about the Anglophone Africa, and Gerard Salem to say something about the Francophone Africa. But I thought the findings were really, really insightful. I learned a lot. And I think, for example, it links very closely to what I think you are looking as a group for the ways forward, which is to facilitate people to communicate, because there seems to be lacking mechanisms for connection across cities and across countries. There's, for example, there was no place for people to put research master's thesis or PhD thesis. They were difficult to find. So there's a lot in terms of the mechanisms for connection around the knowledge that is being produced, which was one of the findings. But also a lot in terms of very good experience on citizen science, youth engagement, accountability, which necessarily is also not connected and not shared. So that's perceived as being one of the important parts. Thank you for the background music. So some of the opportunities were pointed out. So the African Union perhaps could be more engaged, or the African Development Bank, or certain countries like Rwanda with an interest in technology, perhaps we could use that as an entry point, or Kenya, the big 4 policy areas could be an entry point. I'll stop there and I'll say a few things about the Francophone and then pass to my colleagues. The Francophone group had a take, I think there was a lot on the need for understanding how policies are made in context specific, and what are the mechanisms that you could be using to improve that. It was also focused on specific, a lot on pollution, plastics, air pollution, pesticides, extractive processes and their aging of populations. There's a wider range of issues I perceived in opportunities around this business of not only action research, but research on the action and how to use that. I think they pointed out more clearly that although a lot of the drive of the research was from international funding organizations, and there was a limit in terms of the research funds which are coming from the region. So that was perceived as a gap and an opportunity, perhaps, is to look at how to create that. So I'll close just saying, I won't go into that, but that some of the discussion that WHO had on this identified and confirmed some of this, or endorsed some of these findings, including the issue of investigating models for urban governance, to advance urban health, how institutions function, decisions, making feedback loops, that kind of thing. The need to make connections with other initiatives which are similar, which have similar systemic vision or perception of what the drivers are, like disaster risk reduction or climate change. Certainly fostering and the need for fostering regional networks and activities, engaging in empowering population groups such as youth or informal dwellers, formal settlement dwellers, or informal workers, and helping establish mechanisms for knowledge exchange and capacity building. And then the idea of observatories, of what works in urban health, centers that could be focusing on that. And then looking forward, it didn't escape to us that the next COP is going to be North Africa, and that perhaps cities and urban health as linked to climate could be a focus for a conversation. So I'll stop here. I thank you for the opportunity and look forward to the conversation. And I should have said that already, but congratulations on the African Working Group. I'm very pleased that with all you're doing, and we're here to support in any ways possible. I know Gina has been the one that has been helping, but others are also happy to help if needed forward. So I'll pass over to Agnes and to Gerard, if I may, if that's all right.
I see Agnes has said her internet. I see Agnes has said her internet is not good, so not able to speak. So okay. Maybe just invite Gerard if you'd like to say some additional thoughts before I open up. I think it'd be good to get some.
Thanks, Carlos. It was quite clear. Maybe just another point about the complexity of the healthcare organization, the complexity between the different part of this healthcare, the public healthcare system, the public one, private one, and how it's complicated to have any coordination between these different parts of the system. I think it's a key question, and it would be a good way to have an exchange with the decision makers. And the lack of data, I think this is what you said.
Great, thanks, Gerard. So I'm cognizant of the time, but I do think it'd be important just to open up to the floor to see if anyone has any burning thoughts or questions. We will, not thoughts rather, because the thoughts will go into the breakout groups, but any questions specifically clarifying any aspects of what Carlos has presented. Please just use the hand raise function. Oh yes, Susan. And if you can just introduce yourself, say who you are and where you are, and then ask questions.
Thanks, colleagues. I'm jumping in because I have to go to another meeting. But just to say thank you. This really is extremely valuable and just exciting to see so many people from across the continent on the meeting. I just wanted to underscore Nancy's point of if it's possible to see the reports on which some of the work has been based, that really would be enormously helpful. And possibly to think about an African response to that, in other words, to sort of say, where do these really pick up and resonate with stuff that's happening on the continent? And perhaps to begin to start looking at trying to kind of position the African voice at the forefront of the debates and defining the research agenda. I think would be a really fantastic thing to come out of this. So serious engagement with the text as it's there, and then perhaps to get a community from here to try and publish something to push back in the affirmative and in the kind of, you know, with those bits and points that stick with us. So that's by way of saying thank you. I think this is the most serious advance that we've seen in the urban health debate for a very long time.
Excellent. I should say, I think Tiago is in the conversation, but I should say that with WHO, I think the idea is to publish. And one of the ideas is to have the regions to publish. But I think Sue is absolutely right. I mean, the idea is to stimulate conversations, and not only the publication of what this is, and you know, the report is going to be published by WHO, but also the papers that come out of this, but the response. And I think that's an excellent suggestion. Happy to share the slides.
Great, yes. So we will share a link at the end where you can share your details and your contact details should you want to be contacted in terms of sharing the slides from this and obviously be part of the community. That's how we get you going forward. Any other quick question to Carlos or Agnes or Gerard? I don't see any other hands up. Okay, Natalie is confirming absolutely having subsequent complications with regional focus. And Tiago is confirming access made available in the chat. Great. Okay, so I'm going to hand, oh, Gina? Oh no, Julian, hands up. Yes.
Sorry for being so slow with my hand. I was busy working out the technology there. I do think it's also important to note...
Sorry, I didn't ask Sue to remind you, but please just introduce yourself and say who you are and what you did, so that everyone knows. Yeah.
Okay, so I'm Julian Rumbelow. I work in a data and research unit with the Western Cape government. We work in development planning and environment. We work with a lot of planners. We work with infrastructure, housing, etc., but mostly from a planning and environment perspective. And I echo all the great words that have been said about well done for establishing this community of practice. Is definitely the way to go. The reason I raised my hand was just also to acknowledge the difficulties in this space as well. Africa's voice is not heard. There's a lot that needs to be brought to the table. There's an activist voice that has to be heard, and that will be difficult at times. And it's going to be a balance, the same way that Gerard was talking about, the public-private kind of tension that exists. There's also this activist kind of establishment tension. And I think if we're serious about change and transformation, innovation and implementation, we really need to look at that and know when to push hard and also know when to take it easy. So yeah, I just thought I would add that aspect.
Absolutely. Carlos?
I respond to that. I've worked with WHO for a number of years, and I work in academia, and now I'm happily in civil society. So I think that's the value of networks and working across, because some people can be bolder and sort of and that's where the connection is important and can be productive, where you can play different roles and bring out different aspects. So I think I think we were able to do that when I was within WHO, and I think we're also able to do that when I'm out. So I think it's good stuff. But I agree with you, Julian. I think that's essential to have those activist voices and to see who speaks well in which moment. I think that's part of the network in the community of practice.
Great. Thank you. So I'm going to hand over, speaking of community practice, speaking of See Who's in the Network, I'm just going to hand over to Charles to introduce the lead discussants who will be telling us a little bit about their work. Over to you, Charles.
Thanks, Tolu. So from the sort of big picture, we now go to something a little bit more focused. So I think the next part on the agenda is a conversation between Amy and Noxolo. And we're going to be talking about really transdisciplinary research, particularly as it pertains to Cape Town. And then there'll be an opportunity for Q&A, but please also feel free to use the chat as we go along. Amy, over to you.
Great. Hi, everyone. Can you hear me all right? And you can see my slides.
Yes, we can.
Great. That's usually the standing opening line for any Zoom meeting, I believe, these days. Thank you so much, everyone. It's a pleasure meeting everyone and seeing you all online. My colleague Noxie and I, we've been on this journey with Tolu and a few others since about 2017, 2018. And we just want to share with you some just practical tips on what we found works around transdisciplinary research, pairing the academic and policy partnerships together. And we do understand that the transdisciplinary research can involve more than just academia and policy, and does involve civil society, etc. But for us, we are just focusing on this particular partnership. And I'm just very aware of time, so I just letting you know I only have about 4 slides just to provide a very quick high-level summary of the context and what the overall project was, just high-level, quick, and then Noxie and I will be focusing more on the actual process of our engagement and some of the barriers and successes of our process, which we hope will be useful to you if you do want to apply this within your context. So firstly, just to speak a little bit more about why we focused on the Western Cape government and Cape Town within the Western Cape province. There are many informal settlements in South Africa and very much so also in the Western Cape province, which is one of the provinces in South Africa. And at the time of our research when it started, there were about 57% of informal settlements in the province were located in Cape Town specifically. And so this is a real reason as to why we are looking at this, the intersection between health and informal settlement living environments. And so these are just some pictures of the living environments in Cape Town that you might find in informal settlements. Definitely not conducive to health. And the biggest thing that we were trying to work around was kind of the siloed nature that government sectors sort of work in. And things have changed and progressed over time. There are some strategies now emerging within Western Cape government and the city of Cape Town working collaboratively across sectors. So I will premise that. But at the time, we were really trying to find opportunities and ways in which we can insert health considerations within human settlements policies. And so this is just a diagram of our organogram of our research team, which features people across the institutions that we're working in. So Nox, I'll hand over to you to walk us through who was on the research team.
Okay, thanks, Amy. So as you can see on the slide, we had representation from the University of Cape Town, School of Public Health and Family Medicine, represented by Amy and Tolu. And then we had Warren from the African Center for Cities. And then from the Western Cape government side, we had myself and Tracy with the Provincial Department of Human Settlements. And we are formally from the Department of Human Settlements, both of us. We left the institution. And then on the health side, we had Tony from the Department of Health, who also left the department. So yeah, that was the initial interdisciplinary project team. Thanks.
Great. Thanks, Nox. So just a high level, quick insight into what our actual study was before we go into the actual approach of the partnerships. We were looking at exploring the opportunities as well as some of the barriers around incorporating health considerations into human settlement policies at our subnational level. So our research study focused on looking at desktop analysis. So we did literature review on what does the current South African literature show around the health impacts of informal settlement built environments on health in South Africa. We also looked at available policies, exploring the extent to which health is considered within human settlements and urban planning policies. And that's just to scope what the actual research environment is like, showing evidence and building evidence for the case. And then secondly, we decided to interview policymakers from both the Western Cape government and the City of Cape Town to explore what are their perceptions around considerations of health in informal settlement upgrading, which is when they improve the services and the housing structure within these areas. Do they consider health? How is it thought about from the urban planning and human settlements sectors' points of view? And how is this then contrasted to how the health officials see health in these areas? And then we looked at the role of data. What data is available within the health sector? What data is available in the human settlement sectors? And is there a way to integrate these two data sets to create new urban health knowledge? And what would that look like going forward? Can we then use this potentially as a monitoring tool to evaluate the health impacts of informal settlement interventions or built environment interventions going forward? So that was just a high level blurb. If you want to read more, we've got some outputs which we can share afterwards. Knox, I thought to hand over to you now. We're just going to be discussing a little bit about the government administrative processes and the academic processes that we needed to support the project. So Knox, from your side, what were some of the things that you needed to do to assist this research partnership?
So I think what Tolu and Amy had initially done, which helped a lot with the government administration and trying to include the research in our business plans and our performance agreements, was the fact that the project got seed funding from the Office of the Premier. So it was embedded within the Office of the Premier, and it was one of the projects that were funded by the Office of the Premier. So it was a bit more easier to make a case for human settlements to be involved in the process and to contribute towards the research work that was being done. So what we had done from our side, Tracy and myself, was to engage our HOD and our MEC, which is the member of the Executive Council, the political head of the department, and as well as to include the research project in our business plan to say that, okay, this is what we are doing. And as government, you have to account for the time that you are using for work that is not within your performance agreements and your business plan, and also to make a case in terms of what is it that the department would get out from this collaboration in terms of influencing the work that we're doing and the change that we are hoping to see from this collaboration and interdisciplinary partnership. And it was also exciting for us because it was the first time that something like this was being done within the Western Cape government. So it was an opportunity for us to showcase what is possible with this collaboration. Thanks.
Great. And then Tolu, feel free to also jump in because I know you were a part of the academic process. But from our side, I mean, we had to, Tolu was a big part of sourcing some of the funding for this, as well as Warren. And so the academic side brought some of those resources, but it was also in partnership with government efforts. And we also, the transdisciplinary process is great in the way that we can share the load. So we were able to, as academics, found this and ground this within academic debates and theory, as well as support through the writing and publication. Even though this technically is possible from the Western Cape government side, it's just we've got the resources to write and the time to write and actually do the research itself. So I don't know, Tolu, if you have anything more to add around the actual processes to support this type of collaboration.
Yeah, I think the one thing I would say is people and connections, and that's what's so exciting, I think, about this community, right? Because, you know, yes to what you said, but actually what really kicked it off was a serendipitous meeting. So it organized a workshop with different government people from health and human settlements and education and the Premier's office, etc. And we got people together just talk about how health, what their priorities were. You know, so we weren't saying we want to do this, like, this is, what are your priorities? And let's start and think about the ways that health could potentially feature all those relevant. And Tracy, who Noxie mentioned, came up to me in the break, was like, you know, we know what we do matters for human settlements, matters for health, but we just haven't been, I'm like, okay, let's start there. You know, so it was just, I hadn't even thought about it. I was initially thinking about doing something with education because that's where I was working in schools. I was like, okay, this is a ready partner, because there was an opportunity as well, because you were working on your informal settlements upgrading, your medium-term strategic plan, and the rest of that. So there was a timing opportunity to actually do something that mattered to you, Noxie, in your department. So I don't think without that coffee break conversation, we wouldn't be where we are now. So for all of the literature review and for all of the evidence, we needed to meet each other to say, this is what we do that matters, but we haven't done anything, but this is the opportunity. It's like, okay, let's explore how to work together. And then we actually wrote the proposal together to look for funding to start some work.
Good. And actually that's perfect, because I mean, the one thing that we're going to speak about is in these sort of partnerships, obviously you need key champions. We called them our department champions. There was Tracy and Knox from the Human Settlements Department and Tony from Health, and then us from the academia side. But the challenge did emerge when people left. They moved departments, or they moved. And so, Knox, maybe you can walk us through what Knox and I are going to be terming our secondary champions, which are just kind of like our flankers, our support for how to maintain something like this over time when your key department champions leave.
Yes, so in terms of, so we had different types of actors. We had our main champions who were part of the interdisciplinary team, and then we had our secondary champions, because in us doing the research and having the various conversations that we're having, we were like, okay, we're going to do this research, and then what? How do we bring it back to implementation, policy making? How do we influence the different plans that are with human settlements and with the Department of Health at the local government sphere? And we're like, okay, let's identify secondary champions that are actually responsible for implementation. So that's what we did. We roped in planners, we roped in the engineers from the Department of Human Settlements, because some of the things, and I think Amy will reflect on this in the findings that was coming out from specifically some of the people within human settlements, was around, what is it that as human settlements we're doing wrong? Can you just pinpoint what is it that we're doing wrong? Is there something wrong with our standards? Is it our engineering standards or the normal standards of how we're building the houses or upgrading these informal settlements? What is it that we are doing wrong? And we're like, well, we're really not coming from that angle. We are being proactive in terms of thinking about some of the salient issues that we don't normally discuss because we are operating in our silos. So we identified our secondary champions, and it was so good because when the change happens within the institutions, you have some people in the implementation side who can also take up some of the discussions and say, but the research that was done with health and UCT raised certain things around, let us not look at informal settlements in the way that we look at informal settlements as human settlements or housing. Let us look at it in a more proactive manner. And then we also identified some technical people that assisted us with data integration. So you've got all this data from human settlements. As totally indicated, we were developing an informal settlement support plan. And we were doing all of these enumerations within household enumerations within informal settlements and collecting all of this data. And we brought them on board as well, our GIS technician and people that are involved with data governance, just to also walk us through the process in terms of data integration, so that once we've got all of these recommendations and findings from the research, there are people within the implementation space that are able to take ownership and to lead and not feel like, oh my gosh, we're so resistant, fingers are being pointed at us, but who are actually part of the process. So it's important to have these actors. And just to add a side note was that when we were doing this with Amy, I was reflecting on another project that Professor Ronald Berger from Stellenbosch University is trying to do around health and housing in 2 provinces. And if you don't have these actors, it's very difficult. And like what Tolu was saying, that you need the networks and the conversation over coffee to get that foot in the door. So having these champions and secondary champions was really useful for our research projects, because even though we've left, a colleague of mine referred Ronald to me to say, actually, Noxie worked on this project with UCT and the Department of Health, so she might be able to provide some advice on how to approach your research project. So yeah, I don't know whether there's anything you want to include from your side, Amy.
That's great, Nox. Yeah, so just to add, there were a lot of sort of mechanisms which we had to work around. And so just kind of as a last slide, because I know we have almost run out of time, but I thought I'd just share some of the challenges that we did experience regarding this type of partnership, but the ways in which we found maneuverability and thinking out the box. So for example, when there was potentially an unwillingness to engage across government sectors for urban health, it was about identifying what were the win-win opportunities for each sectors, finding ways to not give the additional work to different sectors, but finding aligning ourselves within the actual current vision plans and the strategies and play in both those sectors. Regarding academic funding limitations, I mean, yeah, Noxie spoke a little bit about it earlier, but it's about including these type of projects within government business plans to assist in just aligning resources around that. And then interventions were kind of confined to political focus sometimes. And so this was important, for example, that we gain support from high-level officials. So we did actually take this project to the Minister of Human Settlements and gained his support, which also gave our project a little bit of momentum. And then when there was a lack of trust between government sectors, for example, especially around sharing data, we developed memorandums of understanding, partnership contracts, and included government sectors in the research team. As the research team progressed, we included more members in sort of wider working groups so that we can sort of facilitate trust and partnership and collaboration together. So Talia, is that okay for a little duet? Is there anything else you feel we need to just touch on briefly, or can we hand over to you?
No, I think that's great. It's Charles still chairing this.
Sorry, Charles.
It's okay.
No, that's fantastic. I don't know if anyone has any questions. Perhaps I'll ask you a question. I mean, what were your sort of health data? It's sort of, when it's being captured, it's always captured for a specific reason. It's always donor-driven. How hard was it to sort of get those 2 data sets trying to speak to each other? And was it more about the data itself or the infrastructure behind it? So a huge question, but.
No, that's great. The most amazing thing was the human settlements data was highly disaggregated. So it did also contain geospatial information, which at least in Cape Town, that is a win. It's not often found unless it's a census data set. And so that human settlements data that can be located to specific areas, we were then able to link it to the health data, which isn't actually really able to be geolocated because it's mainly collected at a facility level, but we are able to link it to patient identifiers. And so we'll then be able to identify where the sort of diseases were emerging from in terms of informal settlements. So that was beneficial, not necessarily for the outputs that are generated spatially, because there were some flaws and holes in the data, but just to prove that the concept of merging data sets like this is possible to generate new geospatial information about health trends. And I mean, in the COVID-19 era, we know this is very important to be able to do that, and also to track the determinants of health that are contributing to disease spread and how the hotspots are developing. So Noxie, I don't know if there's anything more to add on the data side.
Yeah, I think also for a positive for us as human settlements, we had intended when we were collecting the data, it was to inform planning. And when the research project, it was an app for us because now the data could be used for something else except the planning to upgrade a certain informal settlement. So the collaboration also revealed another opportunity for the department in terms of what other uses the data that we collect within these areas can illustrate for the department, not to just say, okay, we've got so many shacks in informal settlements, this is the income category of the people in these informal settlements, but it could actually draw, inform or feed into another process, because without this collaboration, some of the integration that Amy did wouldn't have been possible. We would have just collected that data, done our qualification, and just left it there, and then it would have gone to waste for lack of a better word. So from our side as human settlements, I think it also illustrated the opportunities that could be there when you collect data for multiple purposes, not just for a purpose that would respond to your department. And in terms of sharing, as Amy indicated, we had to sign MOUs with Amy and the Department of Health so that they would indicate that they're using the data just for this research and not for any other purposes. And then we got a go ahead with that. And I don't know whether Amy want to share around this. There isn't really a model. Well, at the time, there wasn't a model on how to do data sharing and data integration. So one of the spin-offs of the research was to try and come up with a model on how data sharing and data integration can be done amongst departments.
Fantastic, excellent, win-win all round. Does anyone else have any questions? If not, we can go quickly to the breakout groups, and then hopefully more thoughts and ideas will generate from there. Nope. Perfect. Then I think Gina is on hand to throw us into the breakout rooms.
Yep, I'll go ahead and
I will share. I'll just share my screen quickly. So I'll just there will be a steering group. There will be a steering group member in every room that will be working to capture your information. So I'm just going to share my.
Sorry, Tolu, there's a hand. I'm not sure whether it's an old or a new one.
Oh, Aggie. Yes.
Hi, it's a new one. It's another Agnes hand. Hi, everyone. I'm a GDAR network member as well. I'm based in South Africa, Johannesburg, working at Priceless. And I am from the public health sector. And I was wondering about whenever you mention integrating health consideration into the other sectors' policies. So one thing is, what kind of considerations are we talking about? What are the specificities of what you're trying to look at when it comes to housing? And how did you come to those conclusions? Was there any community engagement? I presume so. And whether you were forming these connections, were you speaking to the communities about their priorities and their needs when it comes to, what to integrate in the housing sector? These are kind of questions that speak to each other. And then I was also wondering about multi-sectoral funding. How do you see that becoming a barrier for the sustainability of projects that cut across sectors, and whether there has been a discussion around that between the various sectors? Thanks.
Okay.
Thanks, Aggie, for your question. And hello. So it's a good question. And the limitations are, or the scope of our research study was just focused on the policy academic partnership. So we didn't engage necessarily with community, because that is an extensive process that does need to happen. But the good thing is that the data which we used from themselves, and so there were elements of community voices coming through the data, because there was reports being written with interviews also being conducted at the local level. But in terms of the actual study itself, it did focus on the policy academic thing regarding considerations for health. I mean, it is quite tricky to define that, but at least for our process, we were building an evidence base. So firstly, looking at what is the sort of the academic literature emerging in terms of is actual urban health being monitored, and secondly, are there urban health or any health monitoring systems in place within the urban health planning sectors? Because if they are, then those mechanisms can be enhanced. But if there's a complete lack of health considerations in terms of any health indicators or any sort of expression or narrative or discourse around health in the policies, then that needs to be highlighted and elevated, and potentially then, depending on the level in which health is considered or spoken about, that will also determine the extent of interaction with the urban health, or the urban sectors. So it would be, maybe knowledge sharing sessions we would have to have, So it's basically we're still in the processes of speaking that through, but it's an important question, and I'm not too sure about how to answer the financing question across. I haven't been involved in conversations just yet around that, but I will note that down. It's a good question. Thank you, Aggie.
Right. Thanks, Amy. Yeah, I think I guess the financing question would come up if we're talking about a specific intervention that cuts across sectors. And then I forgot my other thought, but thanks for the answers.
Great. I think we're ready.
Is it to me? Okay. So as we're getting put into the rooms, this is what we will be discussing. So there'll be a steering group member in each room. By way of introducing yourselves to each other, we want to capture what countries are represented in your group, what sectors are represented. So just use the opportunity to get to know each other a little bit. And then the three questions that we'd like you to explore is like, what do you think, in your opinion, are the key, bearing in mind what Carlos shared earlier, and even the Healthy Cities workshop I shared even before that, what do you think are the urban health priorities in the next year for you? Like, just in the next year, I think we need to be, this is really critical in my city, on the cities that I work in. Are you aware of any activities that you think would be of interest and of relevance to the community of practice? So, did you know that there's another community of practice doing this? Did you know that there's this collaboration happening? Did you know that there's this event that we should, just anything really? The idea for this breakout for today is to be as divergent as possible. So we want to diverge and get as much information from you as possible, so that what this community does is representative of what the community wants, rather than, so don't feel the need to converge around one person says this is a good idea. Don't feel the need to say, yes, I agree. Rather, let's have as many different ideas and thoughts as possible. And then lastly, what do you think this community should focus on that would be of help to you? So, it might not be a priority, but what I would really love from this community is XYZ. So I will hand over now to Gina, who will put everyone into breakout groups and ask the steering group members to please facilitate the discussion. I would say that let's have 20 minutes to do that. And then let's come back and we will have 10, 15 minutes to kind of to talk a little bit about or what next. Does that sound reasonable? Okay, great.
Okay, so I'm gonna open the rooms now.
Great. Are we all coming back slowly? Gina, would you mind sharing the survey? Looks good. Oh, fantastic! Yep. Wow, you're incredibly like reading my mind. You're literally doing things about like 10 seconds before I even think it. It's amazing. Thank you. So just as we're getting back now, just have a look at the chat. We'll just ask a few questions. So in case there was anything you didn't have a chance to share, there'll be space to kind of have that conversation, and importantly, to leave your details. So we will share, the recording, we will share the slides from today, and we will share this, which I will just open up right now, just to run through 2 seconds in the last few minutes. Please use the survey to share your email, please, if you can.
Oh, sorry.
At the end, no, it's all right. Just so that we have it all in one place, it would be great. So if you just fill in the survey quickly at the end, we ask for your email address very quickly. So this is a summary of the conversation that we've just had. Let's zoom in a little bit. Oh, sorry, making you dizzy. So the countries that we had in the breakout groups: Nigeria, South Africa, Mauritius, Ghana, Kenya, New York, US, UK, Uganda. So a nice spread. What's missing? North Africa is missing. So we have to work on that in the future. We asked the sectors. Really, we have a bit of everything: academia, advocacy, civil society, government, academia, policy, cross-cutting, stakeholder engagement. Fantastic. Urban health priorities. Here's some topic areas. You can see here, power structures, accountability mechanisms. Some more topic areas around food, informal trading, maternal, I saw a couple of times. Climate comes up a couple. So climate, food, climate, food comes up a couple of times. Maternal comes up a couple of times. Air quality. I thought this was interesting. That came up from my group. I don't know if it fits here or elsewhere. The need for frameworks for monitoring the impact. So we a lot of focus on outputs for interventions, but not on impact. So the need for that kind of information. Some of the key activities you're aware of, there's HEAT tool. That's the active travel, measuring the health impact of transport tool. There's an Open Gym initiative in South Africa. HEAT tool, who wrote the HEAT tool? Do you want to say quickly?
Yeah, I put it down because it's going global, and initially the HEAT tool was designed for more of settings with more data, settings where we had a lot of data on walking and cycling, and now it's being adapted for cities, city level data that's a bit less intense, and it'll be great to have more African case studies in the HEAT global, so that's why I put it up there. Check it out. We had a soft launch in COP last week, so for COP next year, I think it will be a big thing.
Okay. Fantastic. If you have a link there, just share it in the chat whilst we're here, so we can capture it from the meeting, and we can kind of have a package of resources that we discussed. Open Gym. Who talks about Open Gym initiative in South Africa?
That was me.
Does anyone want to share quickly what that is? Yeah, what is that about? Do you want to just tell people? You're muted.
I can see that, sorry. So I was sharing in my group that there's this initiative that the National Department of Health is trying to implement within communities of building these open gyms to try and address obesity within communities. So that's the open gyms concept. But then they've already received some feedback from communities around how they will not feel safe with these open gyms. So there is that concept that's coming from the National Department of Health. Thanks, Tolu.
Okay. Well, that's interesting, yeah. So there's all the kind of intended and unintended consequences that we need to explore. Otherwise, you put in an intervention and then nobody uses it, and you think, you know, yeah.
Whose priority is it?
Yeah, that's great. There in the chat. Sorry, Carlos?
No, I'm saying whose priority is it? It's part of the actors mapping, you know, who's deciding this priority or not.
Right. Or other question, right? Yeah, yeah. And is that what they would choose otherwise? Absolutely. Yeah, yeah. And then some of the things the community of practice can focus on, so there's a combination of process and content. So there's some content like drought and water availability, transport, urban-rural connections, food, and there's some process things around connecting with each other and synergies and sharing of resources. So that's a really good little kind of way to capture the conversation. I don't know, just in a few seconds, but the non-steering group members, is anything that came in your group to share in plenary? Okay, that's fine. You're feeling a bit shy. That's okay. We'll get this. We'll get this chat here. Not to worry. So that brings us to the end of our first inaugural community African urban health family meeting. Thank you all for your engagement and your contribution. So please complete that survey so that we have your details. We will share, as I said, the resources. What we'll try to do with each sharing is that we will, for each event, share both the recording, but maybe any resources or documents that were mentioned over the course of the couple of hours, we'll kind of put that so that you can refer to that as well. And we will always ask you, maybe I say this now, I'm just making things up as I go, people. Ahead of the next session, we will, now that we have at least a group of people that is more than the steering group, we'll ask you, you know, what do you think we should focus on for the next one? You'll see in the survey, we ask a question whether, like Amy and Noxie did today, whether you have an example of a urban health research collaboration that you would like to share, and whether you'd like to lead the discussions next time. So you can see it was super informal. There's no preparation needed. You could just come with your partner. The way we want to set it up is that so we don't have it as a conference style sharing, but that you can come with a partner, you can just have a conversation about your collaboration. So you can see from some of the discussions in the breakout rooms, people talking about the process, how do you share, how do you actually get these sort of things done? I think this is how we start to do it. In our group, one of the things that came through strongly was that no matter what we focus on, no matter what the thematic areas are, the foundation for any of that is this community and connecting with each other and knowing about each other. And so we will really look to, in the next event, ensure we protect unstructured time so that you can just go into conversation, go into breakout, just meet people and find out about, in my group, 2 people just exchange emails and they're already going to connect after this. And so don't wait for any formal connection. This is the whole point, right? That you can just connect with, this is your community to use as you see fit. So thank you all very much for contributing. And we're hoping to do this, we're aiming to do this quarterly. So the next one will be sometime in the first quarter, right? So the end of quarter of next year. If you have any ideas or any thoughts that come up in the interim between now and then that you forget to share in the survey, because we have your details, we will respond to you and you will have contact details. Just respond anytime. Say, you know, I just thought of it. Oh, I just heard this thing. I thought the community might be interested in this. Please share it with everyone. And because you're not, everyone's here to learn, but we're also the source of expertise for each other. So please share with each other, and let's build our community and improve health in our cities. So thank you all very much, and until next time.
Thank you, Tolu.
Adios.
Thank you.
Well done.
Thanks to our speakers. Thanks to our inaugural speakers. Yes.
Thanks, everyone. Bye.
Bye.
Yes,
yes.
Bye.
Good to see faces. Hi, Deo. Good to see you.
Can I ask a question?
Fui, yes, ask.
Hi, yeah, my name's Fui. I just wanted to find out if there's already a database of best practices that you already have, or because sometimes with these things, it's ideas come forward, but people don't know that actually this has already been tried and this worked or this didn't. So does that something like that?
Yeah. So I don't know if anyone else does anyone else want to answer that before I speak?
Well, there's the compilation that WHO and UN Habitat just put together that we're putting on the internet of tools for urban health. It involves mostly sector-specific interventions, etc., including the HEAT tool that was mentioned. There's around 80 tools with the implementations. It's pretty easy to access. So there's one resource.
But I think your point, Fui, of very practical, like promising practice is part of the reason this community is being put together. Because every time we come together, you know, it just give you an example. When we had that workshop in South Africa in 2019, we had 2 cities that were both part of the 100 Resilient Cities thing. And so they were using the same framework and they were applying it, but one was a bit ahead of the other. And then it said, oh, someone was telling what they were doing. It was like, oh, we did that. We tried that a few months ago. And they're neighboring countries. It didn't work. What you should do is this. Like, oh, if we had known, you know, so these kind of things, this is why we have this community to say, how can we document our shared experience so we can learn from each other in real time? Yes, and then the compendium is a good one. There's some case studies that have been captured by the UN Habitat and WHO that have some, but they're more kind of discrete case studies around this approach. But we really need, what your question is, we really need to build this this resource. So as we're trying things and succeeding and failing, it's all part of a library that others can refer to and adapt and learn from. So yes, you are very welcome.
Thank you, that's very helpful, because I remember in terms of COVID, there's an organization in London called Black Thrive, and when they went out into different parts of the community to speak to Black people about what their concerns were, because it's something that the government weren't doing. So things like that helped inform policy going forward.
Yeah.
So,
yeah.
Thank you.
Yeah. No, thank you. Thanks, Fui. Great. See you next time, and stay in touch.
Definitely. Thank you.
Cheers, everybody. Thanks so much. Well done.